Assalamualaikum to our lecturer, Ms. Nur Atira binti Abdul Rahman and my fellow friends. Today, my group will present about our topic, health-related exercise. My group contains of 6 members. First is me, Muhammad ROSLI, Nur Fatihah binti Ramlan, Muhammad ASHARUDDIN bin Muhammad GHAZALI, Muhammad MUSTAQIM bin Muhammad MANJA, Muhammad HIRZI HAMIDI bin Muhammad HUSAIRY, and Muhammad AFNAN bin ABDULLAH. Introduction of health-related exercise. We already know the importance of healthiness. It is important for our community to really understand what is meant by healthy and how we can achieve it. There are 5 important components in health-related exercise, which is cardiovascular endurance, muscular strength, muscular endurance, flexibility, and body composition. If you are preparing a routine to gain a healthy lifestyle, you should start from this aspect so that you can gain the best benefit of your routine and achieve what you want from the exercise. Cardiovascular endurance is a system that controls the oxygen movement in and out of our body. Muscle strength is different from muscle endurance. Muscle strength is about how much force can a group muscle produce in a short amount of time to do a routine or exercise. Flexibility refers to the range of motion you have around a given joint. Flexibility is more about balance, coordination, and agility of our body. Lastly, body composition, which our body, fat mass or free fat mass. High level of fat in our body will cause variety of disease such as heart attack, hard to inhale oxygen.
Assalamualaikum, my name is Nur Fatihah binti Ramlan. Today I will going to continue the presentation. For the first disease is heart disease. Heart disease is the condition that affect your heart. It also include blood vessel disease such as coronary artery disease, heart rhythm problem, and heart defects. For the factor of the heart disease, they have 8 or many more. For the first one is high blood pressure, high cholesterol, smoking, overweight and obesity, your age, diabetes and have family history or genetic, male and sex. Okay, next is how to reduce heart disease. Heart disease can be reduced by doing 3 exercises, which is aerobic exercise, resistance training, and stretching, flexibility, and balance. For the first exercise that we can do is aerobic exercise. They have 4 functions or many more, but I'm going to share with you just 4 functions of aerobic exercise. For the first one is aerobic exercise can improve your circulation, which result in low blood pressure and heart rate. Second, it will increase your overall aerobic fitness as measured as by using the treadmill test. Third one is will help your cardiac output, and for the last one is aerobic exercise will also reduce the risk of type 2 diabetes, and if you already live with diabetes, it will help you to control your blood glucose. For example of the aerobic exercise that we can do is brisk walking, running, swimming, cycling, playing tennis, and jumping rope. At least you're doing this 30 minutes per day, at least 5 days per week. Okay, next is resistance training, which has a more specific effect on body composition. For example, for people who are carrying a lot of body fats, which is a risk factor of heart disease, it can help reduce fat and create linear muscle mass. From the research shows that a combination of aerobic exercise and resistance work may help rise high density lipoprotein, which is a good cholesterol, and lower the low density lipoprotein, which is a bad cholesterol. For example of the resistance training, which is working out with free weight such as hand weight, dumbbell or barbells, on weight machines with resistance bands, or true body resistance exercise such as push-up, squats, and chin-ups. For the last exercise that we can do to reduce the heart disease is stretching, flexibility, and balance. As we know that flexibility workouts such as stretching doesn't directly contribute to the heart health. What is benefit is musculoskeletal health, which enable you to stay flexible and free from joint pain, cramping, and other muscular issues. The flexibility is a critical part of being able to maintain aerobic exercise and resistance training. For example of the stretching, flexibility, and balance exercise that we can do is Tai Chi and yoga. This will help you to increase or improve this skill, and classes are able in many communities. You can do this exercise for every day and before or after others exercise. For the next disease that is angina threshold. Angina is a chest pain caused by an imbalance between oxygen supply and oxygen demand. They have three types of angina. First is unstable angina, chronic stable angina, and Prince-Metters variant angina. Okay, next is how to reduce angina. We have two or many exercises that we can do, but I'm going to share with you just two exercises, which is low impact activity, which is same as the heart disease, which is aerobic exercise. For example, walking, cycling, and swimming, that's same as aerobic exercise. For the second one is fitness level low, which is you start with a shorter sections, which is 10 to 50 minutes for the first week, but second week you gradually build up to 20 to 60 minutes or more.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad ASHARUDDIN bin Muhammad GHAZALI, and today I will continue my group assignment by explaining about heart attack and high blood pressure. So let's go through for the heart attack first. Okay, what is heart attack? Okay, heart attack is a serious medical emergency in which the supply of blood to the heart is suddenly blocked, that usually by a blood clot. Okay, the lack of blood to the heart could cause of seriously damage of the heart muscle. If it left untreated, the muscle will begin to die. Okay, the medical terms for heart attack is called myocardial infarction. However, most heart attack occur in people with coronary heart disease, which is caused by atherosclerosis. Atherosclerosis is where the arteries become narrow and hardened, that build up of clumps of cholesterol that called plaque. Okay, this is a few symptoms of heart attack, which is chest pain, shortness of breath, overwhelming feeling of anxiety. Okay, now is a few factors of heart attack. Firstly is smoking. Smoking will cause of toxin that are contained in cigarette narrow and change the coronary arteries. Even with small tobacco, it can be harmful. Okay, secondly is diabetes, which is increasing level of blood glucose with type 1 and type 1 diabetes and type 2 diabetes can damage the coronary arteries. Furthermore is overweight and obese. It could lead to increasing of blood glucose that cause damage at coronary arteries. Then lack of exercise, because of increased risk of being overweight and having high blood pressure. And lastly, alcohol. This could cause the hypertension, which is high blood pressure, increased blood cholesterol, and increasing risk of developing CHD, which is coronary heart disease. This is a complication of heart attack, which is commonly happen to the person that having the heart attack. The firstly is arrhythmia, and secondly is cardiogenic shock. Let's go for the arrhythmia, which is an abnormal heartbeat, such as beating quickly, as known as tachycardia, too slowly, bradycardia, or irregularly atrial fibrillation. Okay, this is a few symptoms that happen if the person have arrhythmia, which is fatigue, breathlessness, and chest pain. Okay, secondly is cardiogenic shock. Cardiogenic shock is the heart muscle have been damaged, that the heart can no longer supply enough blood to maintain many of function of the body. The symptom of cardiogenic shock is mental confusion, pale skin, cool hand and feet. Okay, this is a few exercise to boost heart health, which is aerobic exercise and resistance training. Okay, aerobic exercise, it could improve circulation and give a good effect on lower blood pressure and heart rate. Okay, increase of overall aerobic fitness, such as go for running, swimming, and others. It could help the person in their cardiac output. Okay, resistance training has more specific effect on body composition. It could help on reduce fat and create leaner muscle mass. It also could help in raise of HDL, which is a good cholesterol, and lower the LDL, which is the bad cholesterol. Okay, now I will explain about the high blood pressure. Okay, what is high blood pressure? It is the long-term force of the blood against the arteries that may cause heart disease. Blood pressure is determined by the amount of blood of the heart pumps and amount of resistance of blood flow in your arteries. The more blood by heart pumps, the narrower the arteries and the higher of blood pressure. High blood pressure is also known as hypertension. It divided by two, which is primary hypertension and secondary hypertension. Okay, primary hypertension is for most adults because there is no identifiable cause of high blood pressure. And secondary hypertension is some people have high blood pressure caused by an underlying condition. Okay, blood pressure is measured by the systolic or diastolic. Systolic is a peak of blood pressure and diastolic is lower of blood pressure. If consistently raise blood pressure, we increase risk of heart disease. This is a factor of high blood pressure, which is firstly is age. Risk of high blood pressure increase as the age. Okay, secondly is family history. High blood pressure tends to run in the families. Okay. Furthermore, tobacco. Tobacco is a chemical in tobacco can damage lining of the artery walls. And the S is too much salt. Too much sodium in diet can cause the body to retain fluid. And lastly, stress. High level of stress may lead to the temporary high blood pressure. Okay, this is a complication of high blood pressure. Firstly is coronary heart disease, which is heart attack or angina. Secondly, stroke that due to blood clot and bleeding. Thirdly is heart failure, which is heart strain that especially at left ventricular. Lastly, peripheral vascular disease that cause of reduced blood supply to the limbs. Okay, the exercise to prevent high blood pressure, they have two aerobic exercise and weight training. Aerobic exercise is an effective way to control high blood pressure by doing exercise such as cycling, running, and swimming. Okay, for the weight training, by doing weight training, it could improve other aspect of cardiovascular and and help to reduce cardiovascular risk. Okay, there is a few ways to go through weight training, which is learn and use proper form and to reduce risk of injury. Secondly, do not hold the breath during exertion because it could spike in blood pressure. So doing it with breathe easily. Lastly, lift lighter weights more time because heavier weight might require more strength that could cause greater increase in blood pressure. Okay, that's all for me. I will let my group partner to continue our group assignment.
Assalamualaikum, my name is MUHAMAD AFNAN. I will continue the presentation on obesity and diabetes. Okay, overweight and obesity are defined as abnormal or excessive fat accumulation that present a risk to health. A group population measure of obesity, the body mass index in BMI. A person in kilogram divided by the square of his or her height in meter. Okay, next is factor of obesity. First is physical inactivity. Sedentary people burn fewer calories than people who are active. Next is overeating. Overeating lead to weight gain, and especially if the diet is high in fat. Food high in fat or sugar, for example, fast food, fried food, and sweet. All that food has high energy density food that have a lot of calorie in small amount of food. Okay, next is genetic. A person is more likely to develop obesity if one or both parents are obese. Genetics are also affect hormone involved in fat regulation. For example, one genetic cause of obesity in leptin deficiency. Leptin control weight by signaling the brain to eat less when body fat store are high. If for some reason the body cannot produce enough leptin or leptin cannot signal the brain to eat less. Next is frequency of eating. There are many reports of overweight people eating less often than people with normal weight. Scientists have observed that people who eating small meal 4 or 5 times daily have lower cholesterol level and lower or more stable blood sugar than people who eat less frequency 2 or 3 large meat daily. One possible explanation is the small frequency meal produce stable insulin level. Okay, next is risk of obesity. It's very important to take steps to tackle obesity because as well as causing obvious physical change, it can lead to a number of serious and potentially life-threatening, such as type 2 diabetes, coronary heart disease, some type of cancer such as breast cancer and bowel cancer, and the last one is stroke. Next is the best exercise for obesity. First is cycling. Cycling is a great for people of all fitness level and can be done outdoor on a bicycle or indoor on a stationary bike. It has been linked to the various health benefits including increased insulin sensitivity and a reduced risk of certain chronic disease. Next is weight training. Weight training can help you lose weight by burning calories during and after you work out. It may also help you build muscle mass, which rise your resting metabolic rate. Next is interval training. Interval training is an effective weight loss strategy that can be applied to many types of exercise, including running, jumping, biking, and more. Incorporating interval training into your routine can help you burn more calories in less time. Okay, next is swimming. Swimming is great low impact exercise for people looking to lose weight. Moreover, it may help improve your flexibility and reduce risk factor for various diseases. And the last one is yoga. Yoga is a great weight loss exercise that can be done nearly anywhere. It not only burn calories but also teach you mindfulness to help you resist food craving. Diabetes is a condition which the body does not properly process food for use as energy. Most of the food we eating it turn to glucose or sugar for our body to use for energy. The pancreas, an organ that lies near the stomach, make a hormone called insulin to help glucose get into the cell of our bodies. Okay, next is type of diabetes. Type 1. Type 1 diabetes is a condition in which your immune system destroys insulin making cell in your pancreas. They are called beta cell. The condition is usually diagnosed in children and young people, so it used to be called juvenile diabetes. Type 2. Type 2 diabetes is a lifelong disease that keep your body from using insulin the way it should. People with the type 2 diabetes are said to have insulin resistance. People who are middle-aged or elder are mostly like to get kind of diabetes. So it used to be called adult onset diabetes, but type 2 diabetes also affect kids and teens, mainly because of childhood obesity. Next is cause of diabetes. First is dehydration. When there are extra sugar in your blood, you are pee more that your body way of getting rid of it. A large amount of water goes without that urine, causing your body to dry out. Next is weight loss. The glucose that goes out when you pee take a calorie with it. That's why many people with high blood sugar lose weight. Dehydration also play a part. Next is damage to your body. Over time, a high glucose level in your blood can harm the nerve and small blood vessels in your eyes, kidney, and heart. They can also make you more likely to get hardened artery, or which can lead to a heart attack and stroke. Skin and mouth condition. Diabetes may leave you more susceptible to infection of skin and mouth, including bacterial and fungus infection. Gum disease and dry mouth also are most likely. Next, sleep apnea obstructive. Sleep apnea is common in people with type 2 diabetes. Obesity may be the main contributing factor to both conditions. Treating sleep apnea may lower your blood pressure and make you feel more rested, but it's not clear whether it helps improve blood sugar control. Alzheimer's disease. Type 2 diabetes seem to increase the risk of Alzheimer's disease. True. It's not clear why. The worse your blood sugar control, the greater risk appear to be. Exercise for diabetes. First is swimming. Aquatic activity provide another joint-friendly exercise option For example, swimming, water aerobic, aqua jogging, and the other aquatic activities can give your heart, lung, and muscle workout, while putting a little stress on level, much like hand-based exercise does. Okay, next is aerobic dance. Signing up for an aerobic dance or other fitness class might also help you meet your exercise goal. For instance, Zumba is a fitness program that combines dance and aerobic movement for a fast-paced workout. Women type 2 diabetes were more motivated to exercise after taking part in Zumba class for 16 weeks. Okay, next is weightlifting. Weightlifting and other strengthening activity help build your muscle mass, which can increase the number of calories you burn each day. Strength training may also help improve your blood sugar control. Next is resistance band exercise. Weights are the only tool that you can use to strengthen your muscle. You can also perform a wide variety of strengthening activities with resistance band. In addition to increase your strength, exercising with the resistance band may provide modest benefit to your blood and sugar control.
Chronic obstructive pulmonary disease or COPD. COPD is a chronic inflammatory lung disease that caused by obstructed airflow from the lungs. Symptoms included breathing difficulty and cough. It's typically caused by long-term exposure to irritating gas or particulate matter, most often from cigarette smoke. People with COPD are at increased risk of developing heart disease, lung cancer, and variety of other conditions. Although COPD is a progressive disease that gets worse over time, COPD is treatable. As you can see, these are the symptoms of COPD: shortness of breath, especially during physical activity, chest tightness, a chronic cough, lack of energy, untreated weight loss, swelling in ankle, feet, or legs. Airway obstruction. Airway obstruction is divided by two divisions. First is emphysema. This lung disease causes disruption of fragile wall and elastic fiber of the alveoli. Small airway collapse when you exhale, impairing airflow out of your lungs. The other one is chronic bronchitis. In this condition, your bronchial tubes become inflamed and narrowed, and your lungs produce more mucus, which can further block the narrowed tubes. You can develop a chronic cough trying to clear your airways. This is the risk of COPD. First, exposure to tobacco smoke. The most significant risk factor of COPD is long-term cigarette smoking. The more years you smoke, and the more pack you smoke, the greater your risk. All types of smokers also may be at risk, as well as people exposed to large amounts of second-hand smoke. Second is people with asthma. Asthma is a chronic inflammatory airways disease, may be a risk factor for developing COPD. The combination of asthma and smoking increase the risk of COPD. The last point is occupational exposure to dust and chemical. Long-term exposure to chemical and dust in the workplace can irritate and inflame your lungs. In result, you can increase your risk of having COPD. So, what type of exercise that you can do to decrease the risk of COPD? These are the few examples that I give to you. First, before kicking off an exercise program, it's helpful to practice breathing exercise for people living with COPD. Done regularly, this can help make physical exertion easier and more comfortable. Choose a couple of types of exercise or activity that you truly enjoy. Find a workout partner to meet up with regularly. This will make a big difference in your ability to stick with your exercise or routine. Good choice for people with COPD include aerobic or cardiovascular exercise as well as upper body resistance or weight training to help strengthen their heart, lung and surrounding respiratory muscle. These are the examples. You can do jump rope, swimming, cycling, walking or jogging. There are many more exercises that can decrease the risk of COPD. These are just the example. That's all for my part. I will pass this presentation to other group members.
Assalamualaikum to Miss Atira. Today I will discuss and present about the osteoporosis and food intake and energy expenditure. And by the way, my name is Muhammad HIRZI Hamidi. I am from class RSR 245-2A. So what is osteoporosis? So osteoporosis, or in Malay that we call as tulang reput. So osteoporosis is a bone disease that will occur when someone loss of density and weaken bone structure. And bone osteoporosis can affect both men and women. And women are mostly having a significant to having an osteoporosis because of their in their middle age, around 55 and to 65. So, and this is why and the factors of osteoporosis. So the first factors that the people can change because of their maybe when they are young age, especially for a old man, they didn't lack of physical activity such as exercise, workout and jogging whatsoever. And the next factor, because of their low calcium intake and their vitamin D intake. So as you know that calcium is a mineral that is very good for our bone. So if you low your calcium intake in your body, it can directly infection for you to get osteoporosis. For a smoking people, especially for men, also can be a factor to having osteoporosis, because of when you smoke, you always having coughing. So when you cough, and then the ribs on your bone ribs can having a fractures. And this is the factors that the people cannot change. So the first is because of post menopause. This woman, when they didn't having a period for 6 months when they are maybe age 45 and in their middle age. And the second is a parental history, a family history, because the third one is a low body weight. They're having a low body weight, and the fourth one is very you cannot change because of your age. Being over 65, you cannot change because mostly at that time the bone will having a weak. So in this young age, for people need to exercise and take calcium much and vitamin D. So in the 65 of age, so they can having a good healthy life. So for this slide is about risk disease of osteoporosis. So risk disease is because of can become a bone fracture in our body. So bone fracture is not a small injury, it's very big injury, especially for people who may be around middle age. And the most common that fracture will occur is on our spinal and in our wrist, and of course, and the last is on hip fracture. So osteoporosis can be known as a silent disease because people didn't realize they're having osteoporosis until the bone will fracture. So because there's usually no signs or symptoms, so people need to know that they need to exercise more and take calcium much and vitamin D. So after middle age, they can having a good life, good healthy lifestyle. So that is the exercise that you can prevent from having osteoporosis. So this is regular weight-bearing exercise. Maybe for a woman, and woman can walking on the morning, in the morning session, maybe around 10 kilometers, and they can jogging, slow jog, and of course they can go to gym and having a Zumba session with an instructor, so they can get sweat and having a good life and keep their bone working. So after, maybe not after their age, after 45, they're not having a osteoporosis. So for a man, and this woman also can go to gym and work for their strength or resistance training, such as weightlifting, or do some push-up at home and squats. So this is food intake and energy expenditure. This is a very simple discussion that I will discuss. So it's simple. Our body need energy. So where you get the energy, you get from food. So why you need energy? Because we need to stay alive, keep our body warm, and of course a movement and doing some physical activity. So the energy is not same, because people are not having a amount of energy same, because it depends on because of sex. Both men and women are not same energy amount. So sex, age, body composition, and also their physical activity level. So you can compare athletes energy with just regular person energy. So this is simple for us. For people need to know, to maintain our body weight, necessary to balance energy derived from foods. So when we take calories, when we know that calories that we take, so then after the evening, so we can having exercise, we can burn them in the same amount of calories, and our body will maintain. So if people want to lose their weight, they need to take less calories and burn more calories, so the weight will lose. So for people to gain the weight, they need take a lot of food, such as a protein, and they need to work out on their muscle, and after that the weight will gain. And that's all from me. Thank you very much.
Hi, Assalamualaikum. My name is Muhammad Mustaqim bin Muhammad Manja. Today, I will continue this presentation with exercise, diet, and weight loss. Okay, the first point is physical activity is defined as any movement produced by skeletal muscle that require energy expenditure. Next, diet is amount of energy consumed to provide energy. Weight loss is a condition that is influenced by exercise and diet process. In Malaysia, it is recommended to be physically active every day, at least 30 minutes or 2 to 3 times a week. The exercise that can be done is jogging, cycling, and rapid walking. Then, there are advantages of exercise, such as reduce the risk of disease development, such as heart disease and obesity, increase muscle growth, increase heart rate, weight control, and the last point is improve body composition. Okay, for the next point is metabolic rate in exercise. Metabolic rate is the process of body to use and burning the energy from the food. Also, described as all the chemical process that go continuously inside our body, such as breathing, digest, and blood circulation. The concept of metabolic adaptation are when the body's energy expenditure drop to a greater extent until it constant, even though in addition with controlling food intake in diet. Okay, we proceed to effect of metabolic rate during exercise. Okay, the first effect of metabolic rate during exercise is improve the ability to generate ATP energy system to work at higher intensity. The second point is improve breakdown of phosphocreatine, such as extend the capacity of ATP PCR energy system during strength, power, and speed performance. Okay, the third point is temperature regulation. The body will adapt the heat from the exercise and become more effective and efficient at shutting blood to skin to maintain the body temperature through sweat. Okay, the fourth point is body acidity balance. The body become better at tolerating the accumulation of hydrogen ion, which increase muscle acidity and lead quickly to fatigue. The next point is aerobic enzyme activity and production. It can improve the capacity and endurance of the aerobic energy system. And for the last effect of metabolic rate during exercise is lactate removal. Lactate removal will improve the ability to remove accumulated lactate from working muscle cell for rebuild the energy. Okay, for the conclusion, exercising is an activity that gives benefit to the body physically and mentally. Exercise can also increase motivation and can prevent the risk of disease such as heart disease and obesity. Regular exercise activities can also help improve your body abilities to perform daily activity. Okay, that's all from me and from our group. Thanks for watching. Assalamualaikum.